Hello, I'm Lynn Swedberg, and I just completed my graduate certificate in accessibility studies. My research is on occupational therapy education, admission barriers facing disabled students in Washington State. I've practiced accessibility in my long occupational therapy and disability ministry career, and I now teach in the Accessibility Studies program here at Central. I've been horrified to realize how much ableism exists in my beloved occupational therapy, or OT, profession, and have dedicated my capstone project to working to eliminate it. I'm starting at the process of admission to a professional education program. Current accreditation standards are one barrier identified in the literature. Rigid technical standards, which I'll explain in a bit, are another. There are many factors that make the campus climate less disability-friendly or accessible. This slide introduces Laura Bulk, a friend who is blind and has faced many obstacles with getting her OT education. She recently received her PhD, which she is celebrating in this photo. Several of her articles informed my study. My OT activist friend, Sandy Hanebrink, also illustrates the gifts that disabled therapists bring to the profession. She benefited from the 1973 Section 504 of the Rehabilitation Act that entitled all to an equal education, and the Americans with Disabilities Act of 1990 that further spelled out civil rights. The ADA lacks enforcement power, requiring a complaint through the Federal Office of Civil Rights or a lawsuit to push for changes. One key case was run in 2014 by a deaf applicant to Pacific Northwest University of Health Sciences in Yakima. The courts held that providing a sign language interpreter was a reasonable accommodation. This school is now developing an OT program and was included in this research. Allied health professions developed technical standards as a way to designate who was an otherwise qualified applicant, a term introduced in Section 504 and also found in the ADA. While the intent was to prevent discrimination, these criteria for admission to allied health schools are ableist. For example, schools identified body-based abilities such as the need to lift 50 pounds, hear a voice from behind a curtain, stand for a certain length of time, and read instruments, or to demonstrate adequate coordination. These are called organic standards. Less discriminatory requirements, called functional standards, list the outcomes without specifying how they will be carried out. The verbs perceive and move are examples. The standards may specify that the task can be carried out with or without reasonable accommodations. Auxiliary aids means assistive technology, and intermediaries are persons who provide such assistance as sign language interpretation, note-taking, lifting, or task preparation. When trying to understand why allied health professions discriminate against applicants with disabilities, it's helpful to review models of disability. Medicine is steeped in the medical model, which tries to fix or cure the disability and places the patient in a lower status role compared with the practitioner. This model believes that disability is an individual matter and offers treatment to help the person overcome their limitations. OT operates under the rehabilitation model, a variant that works to improve functional abilities to the extent possible. The therapist tends to set goals for the patient. Both models have a hard time accepting a person with a long-term disability as a peer. By contrast, the social model, ascribed to by most disability activists, finds that the social and physical environment set up disabling barriers, and that the disability is not an individual problem. Sandy, pictured here by the only public statue of President F.D. Roosevelt in his wheelchair, illustrates the social model, while the president hid his disability and was a strong proponent of the rehabilitation model. The status quo, that there are few disabled occupational therapists, is perpetuated by myths based in ableism, or discrimination against people with disabilities, and a mindset that typical bodies and minds are of greater value than disabled bodies and minds. They insist that all therapists should be able to practice in any setting and ignore practice changes, like the now required use of mechanical lifts for any patient who needs significant assistance with transfers. They exaggerate the safety risk of disabled therapists, a risk not borne out in the research. The allied health literature includes research about attitudes and barriers faced by disabled students. These quotes from faculty agree that professional programs are often rigid and teachers unsympathetic, with an expectation that all students should be perfect. There is a stigma around offering accommodations as expensive and a form of coddling that will not be available in the real world. The literature suggests many benefits that having more OTs with disabilities would bring, including decreasing health disparities and increasing representation, so the patients with disabilities would be better served. Individuals with lived experience of disability know how to devise creative solutions and model that OT is effective at helping people live productive lives. The photo shows Sandy entering a door pulled open by her service dog, who used a rope that Sandy looped through the door handle. Universal design and the ADA standards for accessible design are powerful tools and frameworks that call for environments, including college campuses, to be made with everyone in mind. If accessibility is built in, it doesn't cost much more, is aesthetically pleasing, and meets everyone's needs. The WCAG 2.1 offers similar guidelines for the online and digital environment, which are also important in accessing today's college world. Here Sandy checks slope using a level. My research identified the 10 schools in Washington State that offer some level of occupational therapy education. 5 of them educate future OT assistants, and 5 educate future OTs at the master's or clinical doctorate level. The schools range from small technical schools to the largest public school in the state. This convenient sample was selected as a pilot study of barriers to admission to OT school. The photo shows Sandy's service dog getting his own diploma at her graduation from OT school. This research adapted a survey tool developed by Zazovi and Associates that assesses technical standards for their compliance with ADA standards. The author gave permission for this use. A total of 10 factors are coded once the technical standards are located on the school's website, though some were not publicly available. Factors analyzed include details about the school's willingness to offer accommodation and required abilities in domains of hearing, sight, and mobility. To supplement the previous questions, the study also searched each website for evidence related to 10 factors indicating how disability inclusive and accessible each school was. These items came from the literature review and included qualifications needed, accommodations and disability-related information provided, non-discrimination statement, disability clubs and courses, and accessibility information features. The data analysis showed that using the Zazovi et al. 2016 tool as is did not yield sufficient information, as the technical standards were less thorough than those of the medical schools studied in the original research. Most schools still used organic standards rather than functional standards, even if they attempted to use non-discriminatory language. The most common barrier noted was a requirement that candidates be able to perceive and respond to nonverbal communication, something difficult for both autistic and blind students. Campus climate findings were that the only item found in all 10 schools was the inclusion of disability in the school's non-discrimination statement. 70% of the DEI sites mentioned disability, and 60% of the OT department sites referred potential disabled students to disability support services. All other indicators were present in 30% or fewer of the schools. When the scores from the technical standards analysis were combined with the campus climate scores, some patterns were apparent. 4 of the 5 OT schools scored in the highest bracket, while only 1 of the OT assistant schools did. In general, the TS scores mirrored the campus climate scores, suggesting that looking at one set of indicators might predict how disability-friendly the other indicator would be. Further research would be needed to determine the accuracy of this hypothesis. The findings suggest some preliminary recommendations in the need to challenge the current ableist barriers and assumptions if the goal of the profession to increase diversity will ever be met. The picture of Laura shows her smiling while delivering an award-winning research presentation. The first of the next steps already came when I had the opportunity to work with Sandy to recommend revisions to 35 of the current OT education standards. We were able, on short notice, to get over 20 people to submit their support for our draft, thanks to Sandy's grassroots networks. She is shown here with her ADA t-shirt claiming that disability rights are civil rights. I intend to publish and present my findings in OT venues and would like to do further research on related barriers. The small sample size and use of a single state limit the applicability of the findings to the current sample. The author had attended several of the schools in the past and provided occasional lectures more recently, which could lead to potential bias. This topic has never been researched in OT, though there are numerous articles in the medical field. I intend to keep teaching in the ASP program and have begun to offer our services in collaboration with the ADAPT committee. I will continue community advocacy and pursue more in-depth accessibility training. I thank Dr. Naomi Jeffrey Peterson for her support of my journey, and I thank you for listening to my presentation.